with what we're doing here at Elder Guide, with I think 70% of people in nursing homes now paying with Medicaid, Medicaid planning, and what you guys do is becoming increasingly more critical for people going into nursing homes. And, from state to state, one of the things we've been dealing with is how much these programs not only vary, but also within the state, how, Medicaid is sort of a generic term, and there end up being usually multiple programs, oftentimes at least one program for nursing home care, but then separate programs for things like assisted living or home health care. Can you just sort of walk me through how that works in Washington, what types of programs you have there?
Sure. So a lot of our clients are coming in and they're doing two things. They're scrambling sometimes to look for long-term care facilities, and that's something that your website's very helpful on. The other thing they're trying to figure out is how to pay for it. And they've maybe heard that there's a program in our state that will help pay for the cost of long-term care, but most people don't know a whole lot about it. And maybe they have a misconception that Medicaid is just for people, families who are very low income. And for long-term care, there's a program in Washington, as in other states, that helps pay for the costs of long-term care, even for people who do have resources. There are resource and income limits, but for many people, especially middle-class people, there is a way forward with getting some help, because the cost of long-term care in our state runs, it's not uncommon for a skilled nursing facility to cost $10,000 a month or more. Right. So, even for someone who has resources and savings, that's a big burden to bear. Many people in Washington don't want to be in a facility, though. They need long-term care, they need help, but they don't want to be in a skilled nursing facility. And maybe that's not even the appropriate place for them to be. Washington has recognized this by setting up a waiver program called COPES, which pays for care not only in assisted living facilities and adult family homes, but also in the home. So you can have paid care providers in the home where Medicaid's paying for those providers. That helps people avoid needing to go into facilities if it's appropriate. We have several other waiver programs too. We have a waiver program for people with intellectual and developmental disabilities, a waiver program for healthcare for workers with disabilities, and sometimes they need long-term care. So we have some new programs for people who are getting close to Medicaid eligibility but aren't quite there yet. So if you are thinking about Medicaid, it's important to learn not just about the main long-term care Medicaid program, but to also see if any of these other waiver programs might help you pay for care.
How does it work as far as getting into these programs? I mean, do they typically have wait lists, or are some of them allowed as an entitlement?
Yeah, so some of them do have wait lists, but the main COPES waiver, although it technically could have a wait list, typically if you apply and you're eligible, you won't need to wait to start getting the benefit.
I guess it all comes down to just how many spots they have available, how many people are applying. Fortunately for people applying, I guess, but unfortunate for others, I think a lot of people don't even know about these programs. So it's probably a tiny percentage of people who should be eligible who are actually looking into them.
Yeah, whenever someone has an intellectual or developmental disability, I always say, get started with an application, because that waiver program is more limited. But the COPES program for long-term care, at least at this point, you shouldn't feel like you can't apply, that you might not be able to get services because of spots in the program. Usually the barrier is actually being able to find home care providers who participate in the Medicaid program, or finding a facility that will accept Medicaid. A lot of times facilities, adult family homes and assisted living facilities that will accept Medicaid first have a private pay period that you have to get through. And so knowing about that in advance allows people to plan so that they retain enough assets to pay to get through that private pay period.
Yeah, it's sort of a second layer of planning of, impoverishing yourself enough to qualify, but not so much that you can't afford to meet these other requirements that are sort of artificially imposed by the facilities.
Right. You need to make sure you haven't given away all of your assets, and then you need to get through a 2-year private pay period at the adult family home that would be the best fit.
Right. And what about, you mentioned something in your guide about a non-Medicaid program. What about like Medicare related programs? What kind of, what do you have there in Washington?
Yeah, well, as everywhere else, a lot of people think that Medicare will pay for long-term care, and they're quite surprised when they call us and let us know the facility has said that they're at the end of their Medicare coverage, and
Right.
they didn't realize there was going to be an end of their Medicare coverage for long-term care. So Medicare will pay for some long-term care, mostly for rehab care, but after that, then there are some other resources before Medicaid that sometimes can be helpful. One is if you're a veteran or if your spouse was a veteran, you may qualify for a cash benefit program through the VA called Aid in Attendance or another program. Also in Washington, we have 2 veterans homes, one in Port Orchard and one in Ording. And so some veterans would prefer to receive care in one of these facilities and be around other veterans. And they're both available to people who have a military background. Some people also have private long-term care insurance that they can go ahead and start using. A lot of times people don't press go on their long-term care insurance because they keep waiting and waiting, thinking they don't want to get started on it and then run out of benefits. I usually tell people once you qualify for long-term care, it's often wise to go ahead and start those benefits. First of all, you'll stop paying the premiums because you'll be on the receiving end instead of the paying side. And you can start the plan then for how to get qualified for Medicaid if after you run out of long-term care insurance, if you're not going to be able to continue paying for care. Also in Washington, we have something that's brand new called the Long-Term Care Trust, which allows workers to pay into through their payroll, a program that will provide up to, right now, the limit is $36,500 per person for long-term care. And the idea is that amount will be enough to help a lot of people get through kind of a short period of long-term care. But it's anticipated that it'll also provide some time for people to do some planning if they're going to need more long-term care than that. That isn't available yet. It won't be available for people to start using until 2025.
And would that be only people that are like in the workforce paying it, or could an 80-year-old person pay into that and get some coverage?
That's a good question. It's intended for people who are working age, and so they're paying in. Not to say that someone who's 80 wouldn't be working, but it's really designed as a program where you're paying in when you don't need the services, so that if someday you do need it, you're eligible to draw from the fund.
Yeah, that's really, I guess, actuarially speaking, the only way an insurance policy is ever going to work is if you have a lot of people paying in up front and then only getting paid out in the back end.